Thank you, Magali, for that kind introduction. Magali and I are linked as sister organizations to bridge the gap that exists between science and the field of application. And so her work and our work will work hand in hand as she takes things and discoveries from the bench, and we take them right into our clinic. Good morning, everyone. On behalf of the Cohen Veteran Network team, welcome again, and thank you for joining us, which we believe this is going to be a very fruitful and exciting inaugural meeting. Inaugural meeting, we're coming back every year, and we'll have a new set of agenda items, and we'll do bioscience, and we'll do clinical, and we're going to show you how it all comes together. And a special welcome to, of course, to our CVN board members who are here in the front row, as well as Linda Rosenberg hiding in the back there. Admiral Mullen and Senator Joe Lieberman and Eric Weingarten are unable to make it today, but they send their regards. And of course, Steve, our founder, what an amazing guy, huh? So thank you all. What I want to do this morning is give you a brief overview of the network by showing you where we are today and where we're going in the next few years, and to share some exciting opportunities that we can advance together. As Garrett mentioned, we're, of course, providing clinical care in our network of clinics, but we want to advance the entire field of mental health, not just veteran mental health. So, Garrett, we are working on that, and we do plan to make a difference that's much broader than the veteran population. But before I get started, I want to share with you the guiding philosophy of CVN. And to do that, I want to use the timely example. I don't know if we have any NFL fans in the room, or Broncos fans to be exact, but a conversation took place between Hall of Famer John Elway and his new quarterback, Trevor Siemian. Elway met one-on-one with Trevor before his big inaugural opening, if you would. He said to Siemian, "Go out and play. Don't look over your shoulder. Don't worry about mistakes. Don't worry about turnovers. You're going to make mistakes, but just bounce back." Elway wanted to give Siemian the clear understanding that he can play without worrying about job security, and instructed him to use all of the tools available to him. Elway went on to say, you know what, we have to give this guy freedom. We've got to let him play. Elway's philosophy, to me, is very similar to that of Steve Cohen. Steve said to me, "Anthony, I don't want you worrying about making mistakes. You're going to make mistakes. Sometimes you're going to be right, and sometimes you're going to be wrong. I could live with those odds of 60% right and 40% wrong. I could live with that, Anthony. But what I want you to understand is that you cannot miss an opportunity." And he emphasized that. Do not miss an opportunity. We can't be risk averse, he said. We have to take chances. So let's go big and let's make a difference. Oh, and stay passionate along the way. I tell you that not because Steve's in the audience or not in the audience. I tell you that because that's what drives CVN and CVB. That's what Magali and I are able to work within, to, as Elway says, to play freely. And with all the tremendous support that we have, how could we fail? This is why we're going to be great. You could call me bold or arrogant, but I know we're on to something, and we have the potential to be great. We have the resources to be great. And oh, by the way, the Broncos are 2-0. And I've already opened 5 clinics in just a year. Who would have thought? Who would have thought? I'm going to have 7 open by next year, and we're going to get to 25 eventually. But before I get a little too excited into my talk, I just want to show you a brief, I think it's a 90-second video, give you a little overview of CVN, then I'll go deeper into what we're all about. Please.
The hardest day of my life was retirement. The camaraderie, the platoon, the training together that you had. We lost 8 really good men.
Heard you say burn.
It's not easy to leave, go to a foreign place, serve your country, and then come back into society seamlessly, especially if you're suffering.
When I got out, I had mass confusion in my mind. I had a daughter back home who I really didn't know.
I have a hard time. I can't really focus on the kids, so I feel like I miss out on a lot of things.
Here you have a veteran returning. You often hear from families that don't feel like it's the same person coming back. Well, it's not. It's a huge adjustment.
The mission of the Cohen Veterans Network is to provide comprehensive mental health services to veterans and their family members.
We've earned the right to lead healthy, fulfilling lives.
I would highly encourage vets not to be afraid to reach out for help.
At the end of the day, our mission is for veterans to have hope.
Thank you. So let me provide you with a little more about CVN and where we are today and where we're going. The Cohen Veterans Network is a nonprofit mental health system designed specifically for veterans and military families. We provide free, and I say free because that's one of the barriers to care that we understand, integrated, high-quality mental health services to veterans and their family members. We fill this critical gap that you hear people talk about community-based services, the need to be close, the need to create better access. That's what we're doing. We're trying to remove all those barriers to care while improving the mental health outcomes for those we serve. Our clinic setting is staffed with 18 clinicians, and we really take our time in trying to find the right clinician. Staff members, many of whom are veterans and military families, so that our clients feel understood and welcome when they come to our clinic, so that we can be defined as a resource that they can trust. We plan to deploy wearables and telehealth and other patient-facing advancements to make it easier for our clients to engage in treatment. In addition to clinical care, we address our patients' holistic needs through clinical case management services. So you see already that our clinics we have a large footprint because we want to do these other things that we think are as important as the clinical care behind the closed door, and that is case management. So we've embedded social workers within all of our clinics to connect with the families that we serve, to help them with those other resources vital to their recovery, such as nutritional information, financial information, housing, employment, medical, and those things that sometimes require special attention, sometimes before, during, or after clinical care. Equally important to our success is for us to be connected to the community. We're not going top down, we want to be community up. So we spend a lot of our effort ensuring that we're connected with the community that we work in, where our clinics reside, and we do that by including outreach workers in our infrastructure to ensure that we're making the connections with our community-based partners, with the local VA partners, and oh, by the way, we have great relationships with the local VAs. With the hospitals in our cities that we're in now, we have wonderful relationships with the VA. But we also want to have relationships with the employers of veterans, fire departments, first responders, police, airlines, those kind of folks. We want to be connected with our community college veteran students, caregivers, family agencies who may not have the resources to support veterans' mental health needs, but we do. So we want to make sure we're connected to them. We feel it's important for our clinics in our surrounding communities to know us, to trust us, and see us as their mental health provider. Early evidence is telling us that the Cohen Military Family Clinics are ideally situated to be community leaders. And what I mean by that is we're able to bring people together because of our credibility, our resources, our competence, and the trust that we bring when we have 70% sometimes of our folks who work in these clinics who are veterans or family members themselves. Our network will grow over the next 3 years. So in 3 years, I'm going from 5 clinics to 25 clinics. I will, and you will see it. We will do it. But in order for me to move to 25, I've got to learn from the first 5. I have to learn quickly, But first, I'd like to say, if you're a CEO or a clinic director of one of our Cohen clinics, would you stand up so people can see you and I could recognize you? Please stand up. So these are the folks leading our first 5. They are leading our first 5. We're learning and growing together. We're in this as a partnership. We're not just a funder. We're a partner. We're a business of doing good by veterans and military families. The demand is high. I can tell you the need is great. My biggest worry was I was going to build a clinic in a community and no one would show up. That's not at all the case. In just 4 months, 2 of our first 4 clinics, 2 of our new clinics, have seen almost 500 patients, new patients. We're talking about episodes of care, up to 14, 15 sessions. And the other 2 have opened up with great enthusiasm in their community. I am certain Los Angeles and Philadelphia are going to be just as productive. And our New York clinic that's been around for 3 years has already seen over 1,000 patients. What we're seeing is about 40% are family members, and I'm thrilled of that. I'm thrilled because they're not eligible for care in the VA. We're able to provide that care. We're able to provide the care in a systems orientation where we have a family and a veteran together. We have family members together. We have children in the family. We're serving spouses and caregivers. We define a family member as anyone the veteran wants to call as a family member. We define as a veteran as anyone who served in our country just 1 day in uniform, regardless of discharge status. But I want you to know I'm not doing this in a vacuum. It's not my style. And so I'm really looking to connect. I'm always looking to establish strategic relationships with you so we can leverage the network I'm building. Imagine that, a network of 25 clinics and what we've done and what we've put in place that you can join us in to advance the field beyond just veterans' mental health. In the past month, I've been engaged in conversations of all kinds. I don't know why all of a sudden, but it's just taken off. Maybe because we've been around a year. But there were 3 large organizations that reached out and said, Anthony, what can we do together to advance mental health? We want to do things. You've built this infrastructure. You've done the due diligence on these communities. You have this electronic health record. How can we join you? How can we add to what you're doing? That's what we're talking about. That's what Mr. Cohen wants. With Mr. Cohen's gift, we, CVN and CVB, and others, have the capacity to be innovative, entrepreneurial, and transformative. It's such a great feeling to be able to say that and be able really to do that. Let's try it. Beyond the high-quality care that we're doing, we're ideally positioned to advance the field of mental health, which I believe all of you want to do. And that's why I'm here today to let you know what we're doing in these clinics. Because if you have an interest, you have an idea, you think there's an opportunity, we want to know about it. And sometimes it gets old hearing all these ideas and opportunities. But remember, Steve told me I had to listen. So I'm listening. I'm listening for that right one that we want to jump on. So we will conduct clinical research in our clinics to find the most effective treatment approaches. We're going to deploy targeted education and training to advance the clinician pipeline because we know that's needed. And we will also create and fund public awareness campaigns to make it okay to get better. It should be okay to get better. I will now highlight 3 areas that I really think we can make a difference in besides just the clinical care. And one is the learning mental health system that we're trying to design. I say trying because we're learning along the way. This is a great learning opportunity for us to take something from what we believe is possible to actually execution. So we designed this learning mental health system that continuously strives to improve and innovate with best practice. We're a system that tracks its patient outcomes in order to learn and improve our practice. We'll use this data collected in our behavioral health record, which we customized just to CVN, to predict patient needs, to guide our clinical decision-making, to identify trends for research, and always keeping a keen eye towards the effective resource allocation. So how can we be even more efficient? Simply stated, we want to ensure that the lessons learned from our clinical experiences are systematically and rapidly put into use to improve patient care, to drive new research opportunities. So what are we seeing that we need to study? What's going on with this data? When we run big data, when we run some analytics, what are we seeing? What trends are we seeing? How can we predict? How can we better manage high-risk patients from the time they fill out that intake paperwork? This is what we want to do to advance the field of mental health. We can do this efficiently, and I know this to be true because we're a small private network, just 25 clinics under one electronic health record. We own that clinic. We're able to be nimble. We have low bureaucracy. That's such a relief. If we want to do it, who's in our way? We're going to do everything right by IRB and patient protections and safeties and informed consents, but we have this opportunity to do something that people talk about doing. For these reasons, people have called us a game changer. The other area I want to talk about is what we're advancing is in the area of education and training. As you are aware, there is a dearth of clinicians who are trained academically and experientially to be prepared to work with veterans. We're missing them. But even more, I've realized in our search for good clinicians to work in our clinic, there's a huge gap in competent clinicians who can work with children and adolescents. We want to move this. We want to help here. And therefore, by keeping the theme of learning, the Cohen Veterans Network has developed partnerships with respected entities and universities to build our own in-house, grow our own education and training program to ensure our clinicians are well trained using the best practices and principles out there while providing a clinical training environment for graduate students. We're calling these graduate students Cohen Scholars. So I'm envisioning in a few years when our network is up and running and we have about 25 clinics. Sometimes that changes. Steve first started with 15. Now it's 25, so that's why I was hesitant to say 25. It might be 30, whereby we're going to be able to recruit from our own. We're going to be able to advance clinicians to directors. We're going to be able to advance students, scholars to clinicians who've been trained in the way that we feel the field needs it. Our capacity to train these students experientially, to me, is exceptional. All these extra dollars are going to these things that we all want to do, like advance research, be a learning mental health system, train the next generation of clinicians. But also, to Garrett's point, we want to have public awareness campaigns where we're eager to impact the narrative around veterans' mental health at both the national and the community level through partnerships with local networks of influence, media giants, PSAs with key leaders and veterans, and the utilization of various social media channels and strategies. We do have a lot of work to do. I'm not naive to that, but it can be done. So as we grow and learn, we'll look for opportunities to partner with experts like you to advance the field of mental health. I believe the future is bright when we all work together. Many have asked me what it's like to be able to lead this network, and I tell them this is just a once-in-a-lifetime opportunity for not only me, but it's for you. It's for all of us. It's for the field. Steve has given us a once-in-a-lifetime opportunity through this amazing gift. More than $250 million, $275 million to do this and to do it right. I mean, who does that? Who does that? The public sector can only do so much, and we know this, and Steve realized this as well, and this is why he established the Cohen Veterans Network as a private establishment to help fill the gap. We're already making a difference. And personally, to be able to meet this critical need for veterans and military families, that very family that I served with for 25 years, the family that I call my own, I think that's pretty cool. So it's an honor, and it doesn't get better than this for me. I love that I'm able to make a difference every day. I'm truly engaged in something that really is transformational and will have long-lasting impact. I know some of you are thinking this can't be true, this isn't real. I just tell you, watch. I'm amazed at what we've done in such a short period of time. So with that, I just want to thank all of you. I want to thank our CVN board that's been tremendously supportive to me and my team. Of course, Steve hears this all the time from me. I thank him, and I thank him again. I look forward to our interactions over the next few days. I'll be looking for opportunities. I may not listen to you right away. You may think I'm not listening, but email me and remind me of that great thing you want to do, or that great discovery you want to share, or how you think we can partner. Hey, look, I'm not the guy who can always figure it out, so maybe you need to spell it out for me sometimes. I'm okay with that. It looks like I have about 9 minutes, and I think it might be fun to have a little bit of audience interaction, and I'm willing to field questions, or you can take the mic and say whatever you'd like, as long as it's good and positive. But anybody have any questions for me, for the Cohen Veterans Network, anything about our mission, what we look for, who we look for in clients and cities? Anybody? Oh, we have a few questions. All right.
Hello? Oh, no. Okay. Martin Hofmann-Apicius. I'm with the University of Bonn, and I will talk tomorrow about the stuff we have been doing. I have one question, one specific question. How big is the resource of electronic patient records that you would have access to? Because we have been involved in projects where we were using any sort of patient records and surgery reports, release letters, whatever, for mining. And you mentioned that buzzword of big data, you know. And those records could actually be quite a resource if they are being properly indexed, mined, and that's why I would really love to learn to what extent you and the Veteran Administration would have access, hopefully, to millions of records.
Yeah, so maybe big data was a little bit too big for CVN, but what we do have is we will have a considerable amount of data. So if we estimate anywhere from 15,000 new patients, and that's conservative, over 25 clinics, times that by at least 10 episodes, 10 encounters with care, that's what, 150,000, 1.5 million entries. There's a lot of entries. There's a lot of notes, a lot of variables that we're looking at. It's a very deep database. So imagine what we can learn from that. And we don't have all the expertise in-house. And so, you know, Magali and I are looking to de-identify our data, create a database, and figure out how we can share that, what rules should be with sharing. We'd want you to join us in publishing. But I also want people to help me look at the data and say, Anthony, did you see this trend? I got an idea. And so we're definitely looking to talk to folks and open that up a bit. And we'll see how that goes over time. But we believe that we're going to have a lot of data to help influence the field. And more importantly for me, we'll have data real time that we can actually improve access, utilization of providers, quality of care. Again, maybe doing some predictions on who comes in with high-risk needs, and then we can deal with that early. The idea of wearing wearables, putting them on our high-risk patients, those kind of things. So it may not be as big as you're used to in terms of millions, but if you think about the number of patients we have, the number of encounters that we have, it's a considerable amount of data. And of course, one day we'll be able to share it in other databases.
Hi, my name is Linda Davis, and I thank you very much for this tremendous opportunity to be with everybody. I'm here in one hat. I'm a veteran, live with PTS, and I'm a survivor and a caregiver. And I thank you for calling out, especially in your work at USC, the important role that caregivers have, not only in the behavioral health of their care receiver, wounded warrior, whatever we're calling that person right now, but the entire family constellation so that they hang together. And we know that's a better way to heal and live a meaningful life. In the Military and Veteran Caregiver Network, we have access to 5 million pre- and post 9/11 caregivers, both in person and electronically and virtually, and I just want to offer that partnership to you. It's especially important because unless we support that family constellation, including the children and youth, we end up with too many people coming to the other organization I work with, and that's the Tragedy Assistance Program for Survivors. So I don't want to see what we see every day with our highest number of new constituents being the survivors of those loved one who has died by suicide. And we want to reduce that and help you in any way we can. So thank you all very much for what you're doing today. It's critically important.
Thank you, Dr. Davis, and thank you for what you do. We definitely want to make sure that people know where we're at, because we want to get ahead of the problem. And that's partly why we're focusing on post 9/11 veterans. We hope that one day we're not having 50-year-old veterans killing themselves, that we were able to help them early. Yes, I have one more time for, well, I have 4 minutes, so maybe 1 or 2. Marv, you can ask me a question anytime. Why are you asking mine?
Well, I'm Marv Southard from, is it on? Marv Southard from the Los Angeles Clinic. And Anthony, this is less of a question than I wanted to specifically thank you for 2 things. One of them is the opportunity that you made possible by having the Cohen clinics associated in some cases with major universities, because, for example, at USC, we've gotten the opportunity to have the School of Education, the School of Engineering, and other schools wanting to contribute to the efforts that we have in place. So it's not just medicine and social work anymore, it's the larger university community that's trying to contribute to the goals that Mr. Cohen has set out. And the second thing is that you've allowed us to focus on the issues of addiction that accompany trauma, because many times in many public policy arenas, people nod in the direction of the issues of addiction, but they don't do anything about it. And I think that's one of our great opportunities here, is that we're going to actually get to address those addiction issues that so complicate the mental health treatment and the trauma recovery. So thank you.
Thank you, Marv. Appreciate that. And, you know, just so everyone knows, our portfolio of clinics, we want it to be diverse. So we do have some universities, but we also have community mental health provider in Dallas. We have a veteran service organization in San Antonio. I'm looking to really diversify this, maybe get a FQHC to do some integrative mental health care, maybe work with a pediatric group to kind of embed a military family clinic in a pediatric setting. So I want to do this kind of integration as well as we grow, but we want to have a diverse portfolio, and we're really proud of our research partners because they also bring the IRB to help us advance the field with research. Okay, this is, I think, maybe the last question.
It's brief. This is Penny Dax, Alzheimer's Drug Discovery Foundation. I'm curious in terms of, veterans suffer from such a range of conditions. So do you have any expectations for what percentage of patients that you'll be seeing are suffering from TBI versus PTSD?
And you know that's a hard one to answer because there's a lot of comorbidity and it's hard sometimes to parse that out. And so that's why we're hiring strong clinicians. But we do look to partner with those who are working in the neuro assessment, neuro testing. I know Jim Kelly's in the room where we're talking about doing something perhaps together in Denver where we can figure out a way to exchange our patients so we can provide the psychological health care for them, and he can provide the TBI assessment and treatment for us, and we can serve their family members that they don't serve. So these are the kind of partnerships I'm looking for because we don't do that under our roof. We are doing a simple assessment to kind of tease it out, and then if there's something there, we're going to have to refer it out. And again, that's why it's important for us to have these outreach workers working with community partners to establish these relationships for referral. And it's back and forth, of course, but we don't have that capacity in our clinics. Perhaps there will be an opportunity where another founder is going to want to advance that element and maybe come and join our network and be that plug-and-play element that we need. And so we do know that we need that. We know it's critical to good assessment and good treatment. And hopefully the discoveries of Magali will give us something to advance in the clinic network, and we'll bring the right people to the table. So one of our strengths is the awareness of what we don't know and what we don't have. And again, we want to make sure we can partner with the right people to address all these issues. So thank you so much. I love talking about this, as you can tell, but I love even more so that you are willing to partner and engage with us along the way. So thanks again, Magali. Your team has done a fabulous job today. I look forward to next year.